Good morning everyone, I'm Dr. Inder from Hair Transplant Center at Clinic Dr. Inder. I've got my patient with me here, doctor here. How are you, doctor?
I'm fine, thank you, Dr. Inder.
Yeah, so I've got a very interesting case today that I need to share with everyone. So my patient who's a doctor, a very well-known figure. So he actually has done 2 hair transplant, that is FUT, the straight method in Spain, many years ago. So that was about 15 years ago. So did twice the straight method, which actually later when I shave you can see that. And then the results were good, he liked it. And then again he went for another hair transplant, and that was FUE.
FUE.
Yeah, follicle unit extraction. That was the latest technique that we're going to do today. That he did once, and that was, how long was that?
It was 5 years back.
5 years back. Yeah, the 5 years back one he did in Turkey.
In Turkey.
Yeah, so in Turkey. So initially he had good results. As time goes by, because of the progressive hair loss, he started to lose his hair again, and after 3 hair transplant, this is how he looked. He has come back to see me, consulted me. What he wants is actually fill up density here. He wants more density. So in fact, he's even done scalp micropigmentation, one of the ways to actually give him more density. So after having a long consultation with me a few days ago, I decided that I will go for another FUE for him, using the back as a donor area, harvesting number of grafts as much as I can. I'm going to do that. I don't promise you the number of how many I'm going to do until I harvest. I will let you know during the lunch hour. Now, after that, what I plan to do the same day after I harvest the back donor area, the scalp as a donor area, I'm going to also do harvesting at the beard area as a donor and put the hair at the crown area, because he's got very limited donor area after doing 3 hair transplant, 2 FUT and 1 FUE. So the donor area is very limited, so I can't harvest many grafts out. So I'm going to use beard as a donor area here. But again, when he was doing the 3rd hair transplant in Turkey, they also extracted his beard as a donor area. So again, I've got a little bit limitation in the number of grafts that I'm going to do in the donor hair as the transplanted from the beard. But anyway, I'm going to do my best for you, don't worry. So I will shave.
Good hands.
Yeah, you in good hands. Yeah, so it's a very challenging day for me today, honestly. Consulted me, I went back. I was actually sitting down and thinking how I'm going to reconstruct you, how I'm going to harvest this. I did some planning in my mind, how I'm going to tackle your case today. So I'm all prepared for your case today. And I am excited too, because I've been waiting to see how much graft I can harvest from your scalp and how much hair I can harvest from your beard area. Okay?
Yes.
So the hair that I harvest from the back of your scalp, I'm going to put it in the front here so that it look more natural. And the hair that I harvest from the beard area, I'm going to fill up density at the crown area. Alright? Okay, so now let me just show the back area. So if we look at it, I've got very limitation of hair at the donor area at the back of his scalp. So it will be a very tedious job for me today to see where exactly I can harvest the grafts, and where, so that he will still have enough hair to cover the scalp at the back, so it won't be like patchy there. And if you look at the area, this area, so I'm going to create density in the front here, and basically the back here, hopefully I can get enough hair from the beard and transplant at this area. And then what is my planning after all this is scalp micropigmentation. Scalp micropigmentation will benefit him because he wants density. He wants to have an illusion of density. So after doing all this, we will do the scalp micropigmentation, and that will really look awesome. So doctor, You all okay? You all alright?
Yeah, fine, yeah.
Yes. So this.
I'm excited also.
Yeah. So you're excited. So what make you think? What make you decide to come to clinic Dr. Inder and to do this procedure?
Because I know like you have a reputation of like let's say the most experienced surgeon in this field.
Yes.
For the last maybe 20 years or more.
Yes, that's right.
So I said in the beginning I just wanted to consult you.
Yes.
Because I went to like other clinics and they said it's hopeless. You don't have any like reserve and it's hopeless. So that's why I just went for micropigmentation.
Oh.
But when I spoke to you, you gave me hope.
Yes.
You told me it's possible. We will see what we can do.
Yes.
So I'd like to try one more time with you.
Yes. Why I have told you that, because when I look at your donor, I can select certain areas. The area that's more hair, I will select that area. And as I see your beard here, of course you have done one time, 1 hour here, but I'm looking at it, maybe this is giving a try. So this is a challenging case for me today. So I like, as being a very experienced doctor like this, when I get this kind of cases, it makes my day, because at the end of the day, if you have the result that I have done,
Yes.
I will be so happy, because many doctors have told you no, you like give up on
Give
you.
up, yes.
Yeah, so and then me coming in and then doing for you, and if you have results, I'll be the happiest person.
Exactly.
Which you will have the result. You
That's
don't
why I
worry.
consulted you, because I know you're the most expert in this field.
Yes.
So I wanted your consultation, and once you advised me, I'll go for it. And
Yes.
I appreciate the challenge you are taking.
Yes.
Because I know sometimes some surgeons, they tend not to take difficult cases to defend their reputation.
Yes.
Sometimes some of them difficult cases, like third session hair transplant, they won't take. They usually take first cases,
Yes.
first or second maximum, which gives a better result.
Results.
So some of them they think about result only.
Yes.
They don't take challenging cases.
Yes, for me it's a
Yeah.
challenging. For me actually it's a very exciting
I
day today.
appreciate
Yes.
that you agreed for
Yes,
that.
because over the years of experience, I'm every day doing normal cases, normal patient coming, normal. Of course, I've done many repair job. I've done repairs. People have done in overseas, hairline repair, donor repair. But today is very challenging day for me, because I'm going to take the donor harvesting from 2 areas, that is back of the scalp and at the beard. So we are going to start the procedure. Thank you so much, doctor. I just want you to relax. I'm going to work on your donor at the back first, so that you are sitting down position, and then once I work on the beard area, this chair, your hair transplant chair, will become a bed, and it'll be more comfortable, because same time I'll be harvesting and same time I'll be start planting the graft for you. All right. So I will know the number of graft that I've harvested from the scalp and from the beard, and then later I will do the distribution, how I'm going to distribute with the number of graft that I have, how much I'm going to put in front and how much I'm going to put behind. Okay, alright? Okay, so thank you so much for this video. Thank you so much for sharing with all my viewers your case, and being supportive enough to be
You're most welcome. I mean, as a doctor myself, so I understand, because I'm a patient too in this field, and I'd like to help all patients.
Yes. So today my case, so I'll be using 2 different devices from Dr. John Cole. Of course, the PCID to harvest the grafts at the donor area behind the scalp. Okay, and then today I'm using beard as a donor area too. The second phase, when I harvest the beard hair from the beard area, I'll be using this instrument called the vertex. So this device more suitable to harvest the hair from the beard area. So later I'll be using both the device. Both the device are from Dr. John Cole's instruments, and of course the chiller and all the other things So I'm going to start the procedure shortly. So if we look closely, you can see that patient has done 2 FUT. So you can see the linear scar around this area. Of course, he's done micropigmentation over that area, but we can see it's quite obvious. So doing the when I'm going to harvest now, I have to avoid all the areas that have been over harvest, and I'm going to go to the area that has hair. I'm going to do the area that is safe zone area, so patient don't mind taking both the temporal area here. So all this area later I will harvest. So before that, I'm going to do ring block injection for the donor area now. So ring block injection at the donor area. Doctor,
Yeah.
I'm going to start giving you the ring block injection, but before that, some test dose. Some tapping is going on. Test dose 1, 2, 3. You alright? Sorry, I've just injected the ring block injection at the donor area at the scalp, and then I've also injected the thermosan fluid for the donor area. Now the whole donor area skin has expanded. So if you can see clearly, you can see again the linear scar. It's all FUT done twice 15 years ago in Spain. You can see the linear scar, and also you can see a lot of FUE marks, which the FUE procedure that he did in Turkey 4 years ago. So you can also see a lot of the areas that they have harvested the graft. So today with my loops, I'm going to be very careful. I'm going to look at the grafts that has 3 hairs, 2 hairs, and I'm going to harvest that. I'm going to make sure that I don't over harvest the areas. So it's going to be a very tedious job for me. So with the help of my loops, I'll be able to do a good job. So right now, the area has been all clean. We're waiting for the thermosan fluid to be set in, and I'm going to be ready to harvest the grafts out. Hi everyone, Dr. Inder here. We are actually halfway through the procedure, just harvesting the back of the scalp. How are you doing?
I'm doing fine.
You're
Thank
doing
you,
fine?
Dr. Inder.
Yes, thank you so much. So doctor used the PCID, and guess what? I managed to do 1,700 grafts for you.
Wow, that's a great, and it's beyond expectation.
Yes, beyond.
I really expected maximum 500 only.
Yes.
According to other surgeons, some of them said even 200 maximum. So getting more than 1,000, more than 1,500, it's a great job.
Yes.
And I hope, inshallah, the outcome will be satisfactory.
It will. I didn't over harvest, that's for sure. I went and picked the area that was not done before. Because last time he did 2 FUT.
Yes.
So that's why I had
Scarring.
areas. Yeah, the scars were there.
Yeah.
But beside it, there were fresh grafts there. So I managed to harvest there. So I'm so happy that I've done 1,700 grafts without over harvesting. Okay,
Yes.
that's very
This
important.
is important without over. Yes.
Yeah, I don't want it to be patchy for you.
Yes.
Yeah, so but I really make sure that it will not happen to you. Even though when you go back, when you go back to your own country.
Yeah. But
Alright?
as you said, after that, after 2 months, we can do like micropigmentation for the scarring.
Yes.
The scarring area and this.
I'm going to
so give it a better, even more aesthetic look, right?
Once everything heals, I will do a lot of things for you. But I really hope you stay with me long enough, because you say you must go back to your country.
I know I'm in good hands. I'm in good hands.
Yes.
That's why I came to you, Dr. Inder.
Yes.
Yeah.
Yeah. So many patients do a lot of research, and after doing the research, they come to me.
Because I'm a doctor also.
Yes.
Like I know about the terminologies and so on, and like some other doctors who are not really real doctors and not specialized, not even in dermatology, not even in a plastic. Some of them are even dentists and they are doing hair transplantation. So to me as a doctor, I knew how to search. And definitely the moment I find your website and I saw some of your videos, immediately I came to know that like you are the most experienced doctor in whole Malaysia in this field.
Thank you so much. Thank you so much.
Most welcome.
So it is a pleasure to get this kind of compliment from a doctor himself telling to another doctor.
That's why it's not a compliment, because I'm a doctor. I'm saying the truth.
Okay, thank you so much. Thank you so much. Okay, so right, so we finish now. So we are going to have a very quick lunch break, and then we're going to continue, because today I told you it's a very special case. I'm not happy with 1,700 grafts, because I'm going to go now and collect more from the beard side to cover for his crown area, and hoping that this will be the last hair transplant for you. You've already done 3, and with me, hopefully I can cover everything, and that's it.
At least for the next years, I want like to be satisfied.
Yes, that's right. So we'll have a short break.
Yes,
Okay. All right. Thank you so much.
Thank you.
So I'm putting in the Thermosan using the cannula method. You okay with the pain?
I'm okay.
Yeah.
The pain is much less than before.
Yes. Hi everyone, I'm Dr. Inder here. I'm with my patient who did hair restoration yesterday, and today he's just done his post-care treatment, and now let's ask some questions to see how yesterday's procedure and how he slept well and how is it up to now. So how are you doing, doctor?
I'm doing fine. I'm doing fine. Thank you, Dr. Inder, for your care and the team, whole team care.
Yes.
Because they stayed with me yesterday till late.
Yes.
I think till 9 o'clock they stayed.
Yes, because we
wanted to finish within 1 day. Yes.
Within 1 day, number one, and we have 2 donors at the back of the head, the scalp area, and the beard as donor. So it was a very tedious job, but nevertheless we were happy to do for doctor, because you know the result speaks by itself. You can see later that the donor area, the beard, because he didn't have much hair at the donor area. Remember I told you yesterday, you have done 3 hair transplant, 2 FUT 15 years ago in Spain and 1 FUE in Turkey 4 years ago. So with the very limited donor area hair, so we used 2 areas. One was the back of the scalp, and one more was the beard. And beard also was limitation again, because he did harvest the graft from the beard the last time. Okay, so what do you think about the whole procedure, doctor?
It was nice. It wasn't painful. It was less painful than the previous times.
Yes.
I liked your method in giving the local
Yes.
with the vibration and the tapping.
Yes.
It was working.
Yes.
It was much less. The previous times the local was killing.
Oh.
I had to take a cloth and bite a cloth not to scream.
Yeah, he was telling his experience on pain management the last time he did other
In
country
Turkey,
in Turkey. I cannot imagine how painful it was because he has to take a cloth and bite because of the pain, and in fact he told the doctor to stop the procedure, that he cannot carry on with the procedure. The doctor said, no, I'm halfway done.
Yes.
And I need to complete it. And can you imagine how much pain at that time he had? But yesterday was so smooth. Just some local ring block injection and he was fine.
Yes.
Yeah, and it's fine.
Maybe
So,
I just needed it like more volume of local because of the scarring,
Yes.
fibrosis.
yeah, so the local fibrosis was there, so I added an additional local anesthesia, which is normally when patient has so much scar, so it's quite common. It's a normal that we add in a little extra local there. So everything went on very well. So if we look at his results here, he wanted the focus to be right at the hairline until the mid scalp. So that's what, with the limited grafts, that's where we did as the way that doctor desired. At the back, he's not so worried. Number one, he can keep long hair and he can comb backwards, he said, so he's not so worried about that. He doesn't really want any coverage in the crown area. Number two, he's okay to do SMP, scalp micropigmentation, at the crown area. So it was very easy. So I just did from the hairline, giving him the volume up to the mid scalp. Okay, alright. So if you look at it, there's a little bit of swelling is there, which is normal. Otherwise, patient is comfortable. Doctor is not in any pain or anything. He's comfortable. So if you let's see the behind. If you look at the donor area, the donor area has healed so well. The punches that I used yesterday, because it was very limited, I had to be very careful with the size of punches, and his hair was very fine. So I managed to use punch 0.65 mm and 0.6 mm. So they all were very small punches size, and you look at it, you can hardly see any of the holes, the punches that I harvested yesterday. All of it has healed within 12 hours. So look at it, how advanced this FUE method that I did for my doctor yesterday. And if you look back again, that is his old scarring. So I did not touch that. So I carefully harvest the area so that I don't over harvest, so that when the hair grows back again, the linear scar will be hidden by his natural hair. So it's a very good planning of the donor area, which I spent a lot of time doing yesterday. And then another donor area is the beard. Actually, doctor told me he don't care, just harvest. I don't want this beard hair, I just want the side of my face. Here, just harvest everything. Yes, I did, but some of it I could not, because the angle and the direction of the hair. So whatever I could do, and I managed to harvest 552 grafts from the beard area. So it's a beautiful, look at it, it's healing so well. I'm so happy for my doctor patient, because the healing process is so well. You're so healthy, everything is healing very well.
Thank you.
Yeah, I would like to thank my patient who's a doctor for choosing Dr. Inder as his hair transplant doctor. He has done a lot of research, and then after doing all the research, he has decided that I am the right doctor for him. So you would like to comment something about it now?
Well, yes, my experience was up to the level of professionalism, and yes, I know I was in good hands. As you said, I researched a lot before coming, and I knew before that your experience, and like in Malaysia, you are the most experienced hair transplant surgeon.
Yes.
And you are following the method of Dr. John Cole.
Yes.
And yeah, everything was perfect. Thank you very much.
Oh yes, thank you so much, doctor. It's a pleasure. I'm always very excited when I do hair transplant to another doctor, because my fellow doctor, he understands exactly, you understand exactly, we know the terms, we know everything, and it's a pleasure for me to do to another doctor this hair restoration. Thank you so much. So just quickly go through the medication. Doctor is going to take this finasteride, which is FDA approved. So it's going to take for a short while now, so that everything is stabilized first. This is a Nizora shampoo that is good for beginning now. We try to avoid any fungus infection, so he has to take it now at least every 1 week 2 times, at least 1 bottle for the next 3 months. And then of course minoxidil spray to make the caliber and the diameter of the hair follicles thicker. This will increase the blood circulation to both the transplanted hair and your own hair. Okay, alright. And then because of just did the hair transplant, there's a lot of healing process that need to take place now for the donor area in the front. So doctor always recommends some very good mineral vitamins just for maybe 3 or 4 months, so that everything the hair is now under stress. So we just take care of it, and we want it to heal fast. And then that's it. And then of course we give some caps, sterile caps to a patient, so that when he goes back, when he goes out, he can wear these sterile caps on. So, and then of course medication to take care after the procedure, like the spray. This is a special spray that we have for the hydration of the graft. So this has the ATP inside, so that it will hydrate, and same time it will take care of the grafts for the healing process. Of course we got good antibiotic creams, so that he put at the donor area for the healing to take place. And then of course the special shampoo which you shake, and then you gently wash around, just circular movements, not too hard, because the grafts are like baby. They're just gone inside now. The grafts are highly confused. Where are they? They were out of the body yesterday, and then we put them back into the body. They need to recognize they're in the same body. They need to know that, hey, I'm in the same body. It's the same blood supply. It's the same DNA. They are confused a little bit. For 2-3 days, after that they realize, hey, I'm in the same body. I need to grow. And they start to grow. You get what I mean? Yes. So these are all your medications. So fantastic, doctor. So when you go out, you need to wear this surgical cap.
Yes.
Yeah, so that
to the sun and wind and.
Yes. Do you understand everything? Do you want to ask? Totally. So I would like to thank you, my doctor, so much for being so supportive of this whole video, the journey that he started from beginning until now. So